Yes, sir, please.
Good morning everyone. I am here to present on the topic clinical profile of patients presenting with retinal vein occlusion and its correlation with serum homocysteine levels. There is no financial support or sponsorship. Retinal vein occlusion is second most common primary retinal vascular disorder following diabetic retinopathy. Its prevalence varies from 0.7 to 1.6%. There are two types of retinal vein occlusions, branch retinal vein occlusion and central retinal vein occlusion. Central vein occlusion is the occlusion of main retinal vein posterior to the lamina cribrosa of the optic nerve and is typically caused by thrombosis. CRVO is further divided into non-ischemic and ischemic. In non-ischemic, it accounts for about 70% of the cases and the vision is usually better than 20/200. The central retinal vein occlusion is major cause of visual impairment and blindness, elevated total homocysteine levels, which is associated with venous thrombosis and cardiovascular diseases. That has been suggested as a major important potential modifiable risk factor for atherosclerosis. Similarly, several studies have demonstrated elevated homocysteine levels as potential risk factor in CRVO. The primary objective is to assess clinical profile of patients presenting with retinal vein occlusion. Secondary objective is to assess the incidence of raised homocysteine levels in retinal vein occlusion patients and its correlation with presenting visual acuity and central retinal thickness. It's a hospital-based cross-sectional study. The inclusion criteria includes the patients aged more than 18 years of age and who are diagnosed with retinal vein occlusion. And the exclusion criteria, we have excluded the retinal pathology patients like diabetic retinopathy, retinal vasculitis, anemia, and leukemic retinopathy, etc. Detailed history of the patients was taken, and baseline blood investigations are done, and comprehensive ocular examination is done, including OCT. And this is the statistical analysis. The mean age group of the patients is 55.90 plus or minus 11.54. And the central retinal venous occlusion patients, they fall under 28% of the patients. And branch retinal vein occlusion, the quadrantic are 60%, macular RVO are 6%, and hemiretinal vein occlusion are 6%. 84% of the patients have come with complaints of diminution of vision, and we have seen 60% of the patients having macular edema. When comparison of the central macular thickness of patients with normal homocysteine versus raised homocysteine level is done, it has shown a non-significant result. And when we have compared the best corrected visual acuity in patients with normal homocysteine levels versus the raised homocysteine levels, it also showed a non-significant result. Among central retinal vein occlusion, branch retinal and macular RVO, the majority fall under the mild homocysteinemia. And when we compare the homocysteine levels in different types of retinal vein occlusions, the central retinal vein occlusion and branch retinal vein occlusion have shown significant results, and in total the retinal vein occlusion has shown significant result with the raised homocysteine levels. The present study indicates the elevated homocysteine levels were prevalent among patients with retinal vein occlusion, aligning with findings from other studies which have identified hyperhomocysteinemia as a notable risk factor. And patients with elevated homocysteine levels had significantly higher values in both CRVO and BRVO groups, which are consistent with previous studies and which also identified elevated homocysteine as the strong risk factor for RVO. However, it did not show any statistically significant correlation between the elevated homocysteine levels, visual acuity and macular thickness. These are the studies. The conclusion is, it is found that retinal vein occlusion is commonly associated with raised homocysteine levels, but there is no association of elevated levels of homocysteine levels in visual acuity and central macular thickness at presentation. Thank you.
Homocysteine is, I don't know, it is thought to be a culprit. I think it's some sort of overrated culprit for any venous occlusion, be it BRV or CRV. What I think. And it's a very costly investigation, especially what we work at a government hospital level, unnecessarily we spend on it. Anyways, generally we go for homocysteine investigation in a young patient who is having BRVO or CRVO, first BRVO. All your patients are above 18 years, elderly population. It's not specifically young patient. You have taken elderly population also, one. And what second question is, what is the novelty of your study? It's a known fact. What is new about your study?
So in the other studies, they have not compared elevated homocysteine levels, the effect of homocysteine levels on the visual acuity and the central macular thickness. So we have studied the correlation between elevated homocysteine levels with the visual acuity and the central macular thickness.
Just one quick question. When you say you have correlated homocysteine with vision, can you explain how, why it cause a change? Homocysteine does not directly cause a change, right?
Yes, ma'am. Directly it is not causing, but we just wanted to know if the amount of homocysteine, it can lead to the severe retinal vein occlusion. So will it is it actually affecting the visual acuity or not? Like,
Okay, maybe you can go back and refer to the literature. Is homocysteine associated more with arterial occlusion or veins occlusion? Okay. So the other thing is there any difference in the kind of visual acuity that you had in patients, or is there any difference between the kind of vascular occlusions with homocysteine levels? I mean, you are having a branch vein.
क्वेश्चन है कि नॉर्मली ऐसा हाइपरटेंशन से हो रहा है CRVO और एक पेशेंट इसको होमोसिस्टीन से हो रहा है, तो व्हाट इज द डिफरेंस इन द पिक्चर?